Hello, my name is Christopher Constantino. I'm a person who stutters, a speech-language pathologist, and an assistant professor at Florida State University. I want to talk about fluency and why it's not the most helpful term for thinking about stuttering and stuttering therapy. At Florida State, I study the subjective experience of stuttering, or how stuttering feels to the speaker. What my research has shown is that the most important thing to people who stutter is how much effort and attention speech takes. I call this experience of effort and attention spontaneity. Speech that has high spontaneity requires little effort and little attention, and speech with low spontaneity requires high effort and high attention. In a recent study, I found that speakers with higher spontaneity were less negatively impacted by their stuttering than speakers with low spontaneity. Fluency, on the other hand, had no effect on stuttering's negative impact. This might be surprising, so why might this have been the case? I'm speculating, but I imagine it's because fluency is often expensive. We can achieve fluency at the expense of spontaneity. We do this through effortful fluency techniques that require a great deal of self-monitoring. We can also do this by trying to pass as fluent through avoidance and hiding our stuttering. Both of these strategies, while increasing fluency, decrease our spontaneity. In other words, fluency achieved at the expense of spontaneity does not lessen the negative impact of stuttering. But improved spontaneity, regardless of fluency, does lessen the negative impact of stuttering. So I want to circle back to what I mentioned at the start, that fluency is not the most helpful word to describe what we work on in stuttering therapy. If we see stuttering as a disorder of fluency, then we'll prioritize fluency in our therapy. Fluency becomes our number one goal, and we lose sight of the more important experience of spontaneity. Fluency is fine. I have nothing against fluency. But it should not come at the expense of spontaneity, because the empirical evidence suggests that spontaneity is more important and meaningful to the speaker who stutters. Therefore, I'm of the opinion that calling stuttering a fluency disorder and calling what we do fluency therapy leads both clinicians and people who stutter themselves down the wrong path. It confuses our priorities and muddles our goals. It would be more clear to all involved if we just called stuttering and the therapy we do stuttering therapy. This would make it more clear what we're working on and more clear about what's important. That's all. I hope you have a wonderful day.